Hello, my name is Lieutenant Colonel Camille Stalkover. I am the 10th Mountain Division Public Affairs Officer. We know you have lots of questions during this very stressful time. I want to assure you that we are working around the clock monitoring the COVID-19 situation here at Fort Drum and in the surrounding communities. Today, our division surgeon, Lieutenant Colonel Jason Ferguson, will provide us with a medical update. Jason.
Thanks, Camille. Hey, Fort Drum, Doc Ferguson here. I'm a family physician, division surgeon here. The team and I have been monitoring your social media posts, your questions, your concerns about coronavirus. We realize there's a lot of information out there in the media, and sometimes it's really hard to understand what to believe, what not to believe, and why things are the way they are, specifically when it comes to some of our medical processes. So this is your local doc's attempt to try to provide you some factual information and maybe some further understanding in what you're seeing right now in the medical community. So when you present to your provider's clinic, hospital, the tent out at the CTMC campus, really your provider is trying to figure out if you have respiratory symptoms, what illness is truly causing it. Is it common cold, which is caused by over 100 different viruses to include rhinoviruses, parainfluenza viruses, and, believe it or not, generic coronaviruses that have already been living with us for many years, decades? Or is it influenza? Or is it coronavirus 19 specifically, the novel coronavirus? This is kind of tricky because, as you'll see with the symptoms, all of these illnesses have some things that overlap, specifically coughing and fever. So the testing strategy, which I'm going to talk about briefly, the methods to the testing strategy really are based on that overlap of symptoms and trying to tease out which one is which. I think a common theme that everyone is clued into these days, and it's been echoed by our senior-most medical leaders within the country, is that yes, there are not enough coronavirus 19 tests for everybody in the country right now. That capability has been growing week by week. The number of test kits, the number of approved types of swabs that hospitals already have, the labs that can process those tests, all those things are growing week by week, and so we are growing our capability, which is reassuring. But to that end, we do have to be sparing with those tests and really use them for the people that we feel are the highest risk. But to that end, when you go and see your provider, when you present there and they're looking through your symptoms and asking you questions, they do already have some tests to help try to filter out what it is that's going on. We have flu tests already. We actually have a test that tests for about 25 to 30 of the most common reasons why the common cold exists, to include generic coronavirus. And this is important because we've actually had phone calls this week from concerned persons who were told that they have coronavirus or they have a friend who is diagnosed with coronavirus. And in the research that we do to those phone calls, they have been generic coronavirus positive tests. Right now in Jefferson County, we have 2 positive cases outside of what I just described. But these are kind of the filters that our providers have before they have to ask themselves, if both of these are negative, do I need to provide or swab somebody to have a coronavirus 19 test and send that to the lab for testing? So again, we are trying to conserve the tests in a methodical means. One of the common questions that people are asking throughout all the social messaging platforms is, why can't we just test everybody now, whether they're symptomatic or not? And it's a very valid question. It's a great question. It's a question that we actually ask ourselves in the medical community about any virus, whether it's flu, the common cold, things like that. And really what it comes down to, and it's not different for coronavirus 19, comes down to viral load in a patient. When people are asymptomatic or don't have symptoms, they traditionally have very low levels of viruses, virus particles, or viral load. And what happens is that if we run a test when somebody has a low viral load, it is very possible that we do not get an adequate sample and that test comes back negative, but in a false way, meaning that that person probably does have that illness, but we couldn't prove it. And when we give somebody a negative test, although it's very reassuring in this day and age, it's also very dangerous because we don't want somebody that has coronavirus 19 walking around unknowingly because the virus, we do know, is so contagious. And so that is the scientific rationale as why we are not and probably will not test grand amounts of people for coronavirus if they don't have symptoms. Those are two of the biggest concerns that people have this week. That is our medical update for today. Would love you guys to keep sending in your questions, concerns, frustrations, and stay tuned for more medical updates.